Hi guys, this is Dr. Priyanka Mehta, gynecologist and women's health expert from Diva Women's Center, Chennai. So we've been talking about fertility, infertility and subfertility. Let's try to understand. So when we talk about the term infertility, that means inability of a couple to have a baby in spite of trying for a year. And when you say trying to conceive or trying to have a baby, that means that they've been having regular, unprotected sexual intercourse. So in case you have been using condom or you've been using some birth control pills or you have not been having regular intercourse, which means in a week at least 3 or 4 times a day if you have not been intimate or you've been living in different places because of your work schedules, then that would not be infertility, and then probably you need to get together and plan better before we start off more investigations or tests for you. When we talk about subfertility, then it means that you are capable of conceiving. There is some minimal or minor problem which we would be doing the test, and then we kind of find out what the reason is. So if we look at the causes of subfertility, that is what happens sometimes. We find out that either there is, in 30% of the times, there is some problem with the female partner, 30% times there is some problem with the male partner, some issues with the sperm, and 30% of the times it is both, and in 10% of cases it is unexplained when everything is fine but that pregnancy is not happening. So this is not a blame game whereby we kind of find out, okay, it is the fault of the female or the fault of the male, and you know how things are. This is a process which is, the couple has to be in this together. So the first and foremost important thing is that as a couple, when you go to your gynecologist or your fertility expert, you go together. You go with an understanding that it is not a race against time, and don't go by all the numbers that, okay, someone has told you your age is 30, your age is 35, and then you can't conceive and all those things. So it does take time, and sometimes once we evaluate and find out the different problems and tests are done, then it takes time for the conception to take place. And talking of the reasons, so if you were to look at the females, sometimes there could be a problem that your ovary is either not producing an egg every month, or the number of eggs have reduced, or there is some issue with the egg quality. Sometimes there can be some block in the fallopian tube, because if you try to understand reproduction, this is the uterus and the lower part is called the cervix, and here you have the vagina. So after sexual intercourse, the sperm swims up across the cervix, and it goes up to the uterus, and then it goes through this opening here into the fallopian tube. The ovary is going to release one egg in the mid-cycle, and this egg is picked up, or the ovum is picked up by the fallopian tube, and then this egg will go into the tube, and the fertilization or the baby is formed inside the tube. And then that little tiny 2-cell and 4-cell being, which is actually called the zygote, will then go through the fallopian tube into the uterus, and then it is going to get fixed here. So the problem could be anywhere, right? There could either be a problem in the sperm, which we will discuss in another video, or there is a problem whereby the sperm is not able to cross here because this discharge or mucus, as we call it, is got some antibodies, or as it is going here, there is a block somewhere in this tube, okay, or this egg is not either coming out, or the zygote, when it is going back, is not getting fixed onto the uterus. So there could be so many reasons, and sometimes it is just unexplained, that everything is fine but we don't find any reason. So if you have been trying for a year and you have been trying with regular unprotected intercourse and you still have not been able to conceive, do visit your doctor and get evaluated. The evaluation that is done first for the male partner, and then we do the evaluation for the female partner after that, and then we try to find out what is the cause and treat accordingly. So Do take care and best wishes for your baby.